increases the risk of not just type 2 diabetes but cardiovascular diseases like stroke and coronary artery disease. For people with diabetes, especially type 2 diabetes who are obese or overweight, weight loss is beneficial. Weight gain is also associated with other problems like hypertension and sleep apnea. Weight gain is associated with obesity and insulin resistance can lead to hyperglycemia. Therefore, even a small degree of weight loss can benefit people with diabetes. Studies have shown that just a weight loss of 1 kilogram can lower HbA1c by 0.1%, and on the other hand, gaining weight is bad because even 3 kg weight gain can offset the benefit of 1% reduction in A1C. It has been shown that people with type 2 diabetes who are overweight or obese, if they lose weight, medications can be reduced. In addition, it has also been shown that a good proportion of weight loss can lead to remission of diabetes, that is, achievement of good blood glucose control even without any medications. There are several approaches to losing weight in people who are obese. And one of them, the most important, is nutrition or diet. The consumption of a low-calorie diet, preferably low in carbs and unhealthy fats, has been one of the important ways how people who have obesity or who are overweight can actually lose their weight. Exercise is also important, but as they say, one cannot outrun a bad diet. Diet is critical, but exercise is not just important to maintain the weight loss. Exercise is important in controlling blood glucose levels, controlling blood pressure levels, cardiovascular fitness, and other aspects of health. The third way for people with type 2 diabetes who are obese or overweight to lose weight is medication. Some of the medications used in obese or overweight type 2 diabetes which can help in weight loss include orlistat, GLP-1 receptor agonists, SGLT2 inhibitors. Newer drugs are being researched as we speak. The fourth way to lose weight is for people who are obese, significantly obese, with a body mass index of say more than 40 or more than 35 kilograms per meter square with comorbidities. That is bariatric surgery. Bariatric surgeries like mini gastric bypass or sleeve gastrectomy, these are surgeries that result in a significant degree of weight loss, and along with that weight loss is associated with improvements in the metabolic health, such as improvements in blood glucose levels and blood pressure levels. Good amount of weight loss can also prevent problems such as osteoarthritis and help in problems such as disordered sleep breathing, also called obstructive sleep apnea. Certainly, weight loss has a very important role to play in reducing the cardiovascular complications of type 2 diabetes. The loss of at least 10% of body weight loss has been shown to reduce cardiovascular events by almost 21%. In addition, in people with type 2 diabetes who are obese, significant amounts of weight loss can not just help in controlling the blood glucose levels, they can reduce cardiovascular mortality as well. The next question is, does weight loss help in reversing diabetes, and how much weight should a person with diabetes reduce to improve their diabetes? It's important to note that the remission of type 2 diabetes is possible. The word remission is a better term than reversal because remission indicates that with good lifestyle measures one is able to control the blood glucose levels, but even after the blood glucose levels have been controlled, significant attention to monitoring and surveillance of diet and nutrition and physical activity is very important to prevent weight regain and subsequent increase in hyperglycemia. Studies have looked at people with a BMI of between 21 to 27 kilograms per meter square, and most studies agree that a 10% weight loss is good to achieve a remission of type 2 diabetes. It must be noted that there is a concept of a personalized fat threshold and that one size does not fit all, and it's always good to check with your physician or nutritionist so that you can decide on the weight loss that is appropriate for you and reach there in a steady, systematic manner so that people with type 2 diabetes who suffer with weight-related problems can live a life of health and wellness. It's very important to note that medicines used for controlling blood glucose level in people with type 2 diabetes have different effects on weight. There are some medicines which actually increase the body weight. Some of them include sulfonylureas like glimepiride and glycoside and glipizide. Some other drugs which can increase the weight gain are a group of drugs called thiazolidinediones or pioglitazone. The third drug, which is an injectable which can increase the weight, is insulin, which can cause some degree of weight gain. At the same time, there are some medications which are used in obese and overweight type 2 diabetes which can help them to lose weight. And these include a group of drugs called SGLT2 inhibitors like empagliflozin and dapagliflozin. They also include certain GLP-1 receptor analogs such as liraglutide and semaglutide. Finally, there are some drugs which neither increase the weight nor decrease the weight. They are weight neutral. They include other commonly used drugs such as metformin, acarbose and voglibos, and certain drugs called DPP-4 inhibitors like sitagliptin and linagliptin. Friends, it's very important to work with your doctor and that the doctor and patient works together to get the appropriate weight management regimen in people with type 2 diabetes so that you can not just control your blood glucose levels. Controlling the blood glucose levels are important, but it's also important to have an optimal weight so that people with diabetes can live a life free of complications and can have health and longevity. Thank you so much for listening to me.